Hi, everyone. It's 12 o'clock, so we'll go ahead and get started. Welcome to the second day of Lunch with Links. My name is Brooke Zuring, and I'm the COVID-19 Training Coordinator for the Immunizations Program. Joining me from the Links team today is Judy Green and Katie Lee. They will be presenting on vaccine administration in Links. This presentation will be recorded and later posted on the Links website, which is lalinks.org, under the Links Training Videos button. During the presentation, please type any questions that you may have in the chat box. There will be a Q&A session following the training where all questions will be addressed. All right, let's get started. I'll turn it over to Judy and Katie now. Judy, if you want to share your screen.
I should be. Is it up?
It's starting to. There we go.
Okay. Good afternoon, everyone. Glad you could join us today. Today, we're going to talk about how to add administered vaccines in the LINK system. All COVID vaccines must be entered as administered and must be deducted from your facility's inventory. So we're going to start out by going into LINK. We're going to go in, we're going to log in. Oh, I think that one didn't work yesterday, did it? With our login and password. Well, it's telling me to log in again. How about that? Evidently, it didn't care for me today. Okay, I'm logged into the COVID test site. I need to select my facility because I'm an organization user right now. So I'm going to go over to select facility. I'm going to select the COVID site 2. I'm going to hit continue. And as we went over yesterday, for any of you that were here, we're going to go and we're going to search for our patient. And our first patient today is going to be David Tester. So in order to search for him, we're going to use his first initial of his first name, which is D, and his date of birth, which is 12/12/1974. We're going to search. Once we search, once we search, we're going to bring up everybody that's first name starts with a D and they have their same birth date. And we're going to look for our patient, which is David Tester. We find him. We're going to select this patient. Once we select the patient, if we don't already have the address information in here, it's very important that we edit our record to be sure that it's updated. There are certain fields that are required for links. One of them is the race, so we're going to choose the race. One of them is ethnicity. We're going to choose the ethnicity. One of them is the sex of the patient. We're going to choose male. Then we're going to enter our address, and all we have to enter is the street name, and then we can go over to the zip code field and type in the zip code, and it will populate the city, the state, and the parish for us. We have to select what type of address it is. This is the patient's legal address. We're going to say it's a valid address, their primary address, and we're going to add it. It's going to come up and say the following address, will be marked as the primary address. We're going to say okay. Then we're going to come to the patient's phone number. It's very important that we get a phone number in here. If you have 2 phone numbers, we can enter them both. If you have only one, we can enter just the one. But if you have 2 and one of them is a cell, we kind of prefer the cell number. And the reason being is because we have a system now called MyIR Mobile, which it will be able to send to you when you do your next shots. it will send you a text over your cell phone. So we're going to put a cell phone number in here, and we're going to put and the phone use code is going to be, we're just going to say it's our primary residence number. This is a cellular phone. It's our primary number, and we're going to add it. Once we've done this, we have all of our demographics now, and we're going to click Save.
I remember going through that process.
Mm-hmm.
Excuse me.
Mm-hmm.
Hello. Hey.
And now you'll see all of our information in on our patient. The next thing we want to do is we want to go over to our vaccinations field, menu item, and we want to view and add this patient's vaccination. When we pull the patient's record up, it will be auto-populated with any vaccine the patient has already had. This patient here happens to have had a Hep B adult vaccine back in 2006. At the very top, it will have the vaccine forecast showing you what this patient is due at this time, if they're due anything. And as you can see right here, we got the COVID-19 vaccine that the patient has not had any. So we started giving it back in December. So that's why the recommended date is December. And the forecasted dose is dose number 1. Once we get to this, we're going all the way to the bottom of our page because we're going to administer COVID vaccine. Please note on here that we have 3 COVID vaccines available now. We have the Pfizer vaccine, and it will tell you the type of vaccine, and it will be Pfizer. Your Moderna vaccine will be the second choice here. It will have the vaccine type, and then it will have Moderna. And our newest vaccine is the new Johnson & Johnson, which is called Janssen. And when you get to this area, it will have the type of vaccine it is, and then it will have in parentheses Janssen, which is your new Johnson & Johnson vaccine. So today we're going to give a Moderna vaccine. We're going to go into the field right here, and if we're given the vaccine today and entering it into the system today, which is what we call real time and should be done, we can merely double click in this box and it will automatically populate the date. Had we given this vaccine yesterday and we're just putting it in the system today, we could simply go up here and change the date to the 8th. But if we're given the vaccine today, when we get to this box, if you just double click in the box, it will automatically populate the date for you. Once we've put the date in there, we're going to go right here to where it says Add Administered. We're going to add an administered vaccine. COVID vaccine is not eligible for BFC eligibility, so you'll go to your next page and it will have the BFC eligibility update. It will show you that this patient's ineligible, so simply click Continue. Once we hit that, it's going to come up with our vaccination detail page. It shows you here that we're giving a COVID vaccine, the Moderna vaccine. Today is the day it is administered. It's showing you it is not historical. In order to get our lot number on the patient's record so it can decrement our inventory, we're going to go right here to manufacturer where it says click to select. And when we do that, it's going to pop up a window that will show us the available lot numbers that we have for the Moderna vaccine. And currently we have 19 doses of this lot and 25 of this. Anytime you see the yellow like this, that means we're within 30 days of that vaccine being expiring, and that's what it will show you. So you need to be sure and select the correct lot number of the vaccine that you're given. Just hit the little select button. It will automatically populate for you the manufacturer, the lot number, and the funding source being public. It will populate your facility, which is showing you COVID Site 2. You will want to put in your anatomical site, which we're going to say the left arm. You'll put the route in. We're going to say it's IM. That's simply really all you have to do. You go down here and you click Save. And it's going to populate our record. Now, let's say that you got through looking at this vaccine and you said, oh, actually, we gave this vaccine yesterday. We did not give it today. I need to make a correction. You can simply click on this date because you see it's in blue. That means this, that I put it in under this facility. It will always be in blue for you. So if I need to correct anything on it, I can simply hit this date. It will open this record back up for me and show you that we gave it, and it will also show you who put the vaccine in. I'm using the username of COVID test. If you had put it in, or if I had put it in under my name, it would say Judy Green or Jay Green is my login. So right now we got to change this date, so we can simply go down here and edit this record. Go back to our edit page. And hopefully your computer system's not as slow as mine, because I happen to live in the country and I don't have the fastest internet there is. Sometimes it's good, sometimes it's not so good. And we have had a little bit of a problem with this page loading as fast as it should, and we actually have a ticket into our vendor to be working on this situation. So this is the one that the only page that should be kind of lingering for you to be able to pull open. So when I get my page back open, if you see right here that I administered this vaccine on the 9th, it will not let me edit this vaccine. It will not let me edit a date. So the only way I can edit this vaccine is cancel this out. Now, if I would use the wrong lot number, I could go back to select and select the other lot number. So in order to correct the vaccine that you entered on the wrong date, you literally have to delete the record and go and re-enter the record again. And you can do this by hitting the delete record button. It's going to ask you, do you want to delete this vaccination? If you do, hit delete. If you don't, hit cancel. I'm going to delete the record. And you'll notice it's no longer on there. So what I have to do is I will have to go back down. I will have to again hit this, and I'll have to select the 8, add administered. Continue again. Click to select my lot number. Select my lot number, which you see I have 19 doses available right now of this. Once I do, I'm going to hit my site again. I'm going to hit my route again. I'm going to save it. and I have it back in here with the correct date. So that's how you add an administered vaccine into the system. All COVID vaccine has to be entered into links as administered. No COVID vaccine should ever be entered into links as historical. So now we can have questions.
If anyone has any questions, you're welcome to type it in the chat box or unmute yourself. We did have a question about who do I call to find out when I am receiving a vaccine shipment. That is sent on Thursdays from LA Immunizations at la.gov. It'll tell how many vaccines you're getting, if they're prime or boost doses, and what brand, as well as where it's coming from, Morrison Dixon or Ship Direct. After you get those emails, you usually will get your vaccine shipment the next week on the Monday or the Tuesday.
I have a question.
Okay.
I would like to ask, with the vaccine, it left, it'll come back.
Oh, okay.
I was listening to you talk and it left.
There's a question, where can I find yesterday's training? We're still working on adding the training to our YouTube page. There was some problems with editing the video, but it should be up there by the end of today. The next question is, do you have an update on the governor's need updates he made at noon?
No, we don't, but I've kind of heard rumors that he's just going to open it up a little bit more for more people to be able to get the vaccine. But I think he's supposed to, as a matter of fact, he should be giving us his directive at this time, I do believe.
How do
And
we
as
get
far
credit?
as things like that go, I can tell you that y'all usually know that as soon as we know it, because we hear it the same way you do through the news media.
Question was about the video. Will we have access to the presentation you just completed?
Yes, ma'am.
Yes, ma'am.
We're trying to get it up as soon as possible. There's a few snags, but it should be up by the end of today.
Thank you.
No problem.
There's also, if you go onto the home page of links, we're updating a lot of these videos at this present time, but we still do have them up. And you can go right here in the home page, you see links training videos. You can click on that portion right there. And these are all very short YouTube videos that it carries you right to. Most of them are max 3 minutes long.
When you're documenting a vaccine from another EMR and it's interfacing with links and there's decrementing issues, what causes that decrementing issue?
Well, there's many things that can. Excuse me. Number one thing usually is your inventory and links has to be exactly as your inventory is that you're submitting over through your EHR. So let's say, for example, the biggest problem we usually see is people that are keying in their lot numbers into their EHR, and you might have a lot number that's in links, and it might be, let's say it might be E1234, and a lot of people have a habit of either putting E space 1234, or if there's a 0 in it, a lot of times people will use the O key on their keyboard instead of using the 0. That will make it not decrement. The expiration date has to be exactly the same. The manufacturer has to be exactly the same. There are certain required fields that have to be included in order for the EHR to send it over. Now, any EHR that we have, somebody in your clinic gets a weekly report showing them any records that had warnings, any records that didn't decrement possibly, and any record that failed to come to us because it was lacking something, like address is a mandatory field, sex is mandatory, race is mandatory, ethnicity is mandatory. So if any of those are left off in the EHR message, then it will fail and the record will not even come to us.
Well, all of these have gone through, but when I go in and run the report, it shows that they're not decremented. So I have to manually go in and decrement them. Could that be because the pharmacy maybe didn't put the inventory or that lot number into links prior to the administration?
That's exactly right. And we're seeing a lot of that with COVID. Because a lot of your COVID vaccines,
600, I was having to go in and manually decrement, which is ridiculously time consuming, but
okay, was that, yes, I'm sure it is time consuming, but was the inventory entered into links before you started administering it?
I honestly don't know because I don't have the access to that. That's my pharmacist who is responsible for that. And when we first started, I know there were some issues, but I'm assuming that's what the problem is.
Yes, because that's what we're finding a lot of, especially where if you're in a hospital setting.
Yes.
And these pharmacists are responsible for putting this vaccine in. We have found them being 2 days after they started administering the vaccine before they ever put it in their inventory. And we're trying our best to try to individually talk to these people to explain to them that this vaccine cannot decrement until they get that inventory in there. Now, in your case, Katie, is that who I'm talking to?
Yes, ma'am.
Okay. In your case, a lot of times, if we know that, and if there's a lot of records, like you said, you had 600,
Mm-hmm.
if in fact that inventory is then put in there, your EHR a lot of times can resend those messages over to us, and they will decrement the inventory for you.
Oh, well, I only have about 100 left at this point.
Yeah.
But that's good to know
Yeah.
for future reference.
Yeah, and another problem we see is every facility has a facility ID, the same as your patients have the CIS patient ID.
Right.
Every facility has an ID, and if your EHR does not have that correct facility ID in that message they're sending over, then there's another reason it won't decrement.
Okay.
So
Thank
there's
you.
many reasons, but
Well, I just checked all the address and all of that information. I knew those things weren't the issue, so I was just trying to narrow it down so that I can educate the
it
correct
sounds to me
person.
like they didn't put that inventory in there before you started administering it and putting it in your EHR.
Yes, ma'am.
That's the biggest thing that we're finding right now.
Okay, thank you.
Yeah. Okay, any other questions?
The next question is, who would we speak to about whether our EHR system could be linked with links?
Okay, that person is going to be, if you want to put that in the chat, Brooke, it's Alexander.Chan, CHAN, at la.gov. He is our PHC hub and interface person. And all they have to do is send him an email, and he will contact them right back.
Next question is, I work for a dialysis company and we give the flu, Hep B, and pneumonia shots. If I would like to add other vaccines, would you hit the historical button?
I'm sorry, I didn't understand that.
Everybody can make sure that their mics are muted if they're not speaking. Thank you. Says, I work for a dialysis company and we give the flu, Hep B, and pneumonia vaccines. If I would like to add other vaccines, would you hit the historical button?
Yes, you can. You can enter other vaccines as historical. So all you would do at that point in time, I'll go back to this view ad page. I should still have my patient up. and let's say that I were going to give this patient an influenza vaccine, I can come down here and pick my influenza vaccine. If I gave it today, I can double click the date right here and simply add historical. The only vaccines you cannot enter into the system, the historical, are COVID vaccines, and if you're a BFC provider, any BFC vaccines have to be entered as administered. And you'll notice right here that after I put that flu in here, that there's a little asterisk right there. That means that the vaccine was entered as a historical vaccine. Any other questions?
There's no more in the chat box. Does anybody else have any other questions? Okay, then.
Okay. Well, I thank y'all.
For attending
And
today's
for all of your information also, whatever region you happen to be in, when you get on the home page of links, we have a map that shows all the regions of the state. It's a color-coded map. And each one of your regions over to the right, it has the contact person for that region. So if you have any additional questions, you can feel free to email them or phone them, and they will be glad to assist you. We also have a help desk. Right here, we have a chat help desk, an email, and a phone number that you can call and ask, and they're all operational from 8 to 4:30, Monday through Friday.
For anyone interested in tomorrow's training will be on vaccine orders and transfers, and you can find a complete list of all trainings on the LDH website under the provider webpage. And for any links related questions, please feel free to email la.links@la.gov. Thank you, everyone.
Thank you.